If your child is being admitted for a 14-day course of intravenous antibiotics, the medications will be administered directly into a vein, usually the big one on the inside of the elbow via a sterile plastic tube. This is called a PICC line. The insertion procedure requires a general anaesthetic, so you'll be asked to give consent beforehand.
Part of the preparation for going to theatre is that you must fast. Generally, you'll be needing to fast your child for 6 hours. That means a drink of water up until 2 hours before your child's due to go to theatre, and then nothing 2 hours before the time given. Really important though, do check with the nurse that's looking after your child for the day.
When it's time for the procedure, a personal care attendant will escort you and your child to theatre. All paperwork and identification details will be checked by 2 nurses before you leave the ward, and rechecked when you arrive at theatre. While your child is in hospital, you'll meet various members of our Cystic Fibrosis Multidisciplinary Team. Depending on your child's needs, you could meet the dietitian, physio, clinical liaison nurse, social worker, education liaison officer, play therapist or Aboriginal liaison officer.
So there's a strong team made up of many different members from different disciplines, and they each bring something special to the table when it comes to dealing with cystic fibrosis. And we meet every Monday as a team to discuss different options and to make sure that we're doing the best we can for each patient.
A typical day during the admission follows a regular routine. Early medication, breakfast, nebulisations, physio, lung function tests on Monday and Thursday, lunch and afternoon physio. IV and oral medications will be given at set times during the day.
During this time in hospital, it is really important to have a good routine, to have structures in place so that the child knows what's going to happen in their day, so that things are as predictable as possible for them. They know what to anticipate, and that helps them manage their day and cope better with the 2-week admission.
I'm one of the ward physiotherapists, and during the week the ward physiotherapist will come and see your child twice a day. Over the weekend we come and see you once, and the second session we ask that you do yourself as you usually would at home. And we find this is a great time for you to do the physiotherapy and give us some feedback about how the program is going for you. Physiotherapy is a very important part of your child's care whilst they're here in hospital. We want to make sure the airway clearance is as effective as possible to optimise your antibiotic therapy.
Princess Margaret Hospital has a specific cystic fibrosis infection control policy based on the Australian CFA policy.
So for infection control purposes, we follow standard guidelines in which someone with cystic fibrosis should not be in the physical presence of someone else with cystic fibrosis.
After your child's condition has stabilised, hospital in the home, often just called HIS, may be considered. This decision is made by the medical staff in consultation with the whole multidisciplinary team. Many factors are involved, so it may or may not be a suitable option.
So the big thing about hospital in the home that I'd like parents to know is to not rush out on hospital in the home. It's very important to give the team time to get everything in place and everything ready for hospital in the home to ensure the best outcome of the admission.
While your child is an inpatient at PMH, there is no charge for any medication. Discharge medication orders will be written up by the ward doctors. Collect medications from the pharmacy the day before discharge. 10 days worth of medication are issued as a discharge script, together with a script for an additional 3 months. Children with cystic fibrosis are entitled to their own healthcare card, so they get medication at reduced rates.